Hello, my name is Jonathan Rerucha, and today I'll be talking about reducing the implications of misdiagnosis and overprescribing stimulant medications and attention deficit hyperactivity disorder in the United States. Characterized as one of the most common neurodevelopmental disorders in the U.S., approximately 17 million people are diagnosed with ADHD in the U.S. The National Center on Addiction and Substance Abuse reports a 369% increase in prescriptions to treat ADHD in the U.S., which equates to approximately 23.4 million prescriptions per year. This results in healthcare costs between $143 and $266 billion annually. The increased prevalence of ADHD in the U.S. raises concern about the reliability of clinical diagnostic evaluations by physicians and the subsequent prescription of stimulant medications, especially without consultation with a behavioral therapist beforehand. This also results in high potential for substance abuse in later developmental stages for those diagnosed with ADHD and those who abuse the system in order to achieve stimulants for enhanced studying or recreational use. Medications to treat ADHD are regulated by the U.S. Food and Drug Administration, or the FDA. Current regulation emphasizes Schedule II stimulants used to treat ADHD. Recently, though, the FDA has recognized that clinicians have reported low confidence and lack of up-to-date knowledge about stimulant medication prescribing for treatment of ADHD. The FDA, along with Centers for Medicare and Medicaid Services in collaboration with the Medicaid Integrity Group, work together to address concerns related to clinicians prescribing stimulants, as well as concerns related to medications outside of FDA-approved product labeling for dosage, age, indication, or therapy duration. These efforts are made to keep clinicians and other providers up to date on the proper use of stimulants and related medications in the treatment of ADHD-diagnosed adults. The status quo today in the U.S. is the use of stimulants to treat ADHD and has been primary course of action since the 1930s. The prevalence of ADHD is continually increasing in the U.S., as well as the financial burden of supporting the improper diagnosis and treatment of ADHD. Alternatives stated in this policy brief are: 1, an increase in clinical awareness and non-stimulant medications, which would improve by improving clinical awareness and continued education and training in the diagnosis and treatment of ADHD. Also, with the use of stimulant medications for treatment of ADHD, lacks any substance abuse potential, which could result in a decrease of substance abuse later in developmental stages among individuals diagnosed with ADHD. 2, increase in behavioral therapy, decrease in pharmacological intervention, and exploration of natural remedies. These unique treatment methodologies could potentially reduce some of the adverse effects of pharmacological interventions and also lay groundwork for further investigation into practices in the overall treatment of ADHD. I recommend that most effective alternative for this policy brief investigated is to increase clinical awareness of proper diagnosis of ADHD, decrease pharmaceutical stimulant medications, as well as increase the prescription of non-abuse potential non-stimulants as the primary form of medical treatment. By responsibly making an appropriate mental health diagnosis, recognizing signs of addictive behavior, and clinically assessing drug toxicology among diagnosed individuals to evaluate medication adherence, as well as increase in prescription non-stimulants, all have potential to create healthier outcomes for individuals seeking diagnosis, those diagnosed, and those already receiving treatment for ADHD. In conclusion, in following the necessary steps, increase clinical awareness of misdiagnosis and overprescribing stimulant medications, as well as increase in prescribing non-stimulants to reduce potential for substance abuse. This methodology poses as an intervention geared for success to reduce the financial burden, decrease the overall prevalence of misdiagnosed ADHD, as well as provide healthier outcomes for those with ADHD. Thank you for your time.